All right, thank you. Thank you for the opportunity to read this paper. I enjoyed it, and I liked the approach that it adopted. Especially, I like how it uses the concept of life course and linked lives in understanding how people shape their decisions. I like this approach, and I'd like to see more people using it, because I think people do take family considerations into account when they make decisions. And in turn, these decisions, of course, affect the lives of other family members. And in this study, today we learned that the lives of grandparents and grandchildren are linked, not just the lives of parents and children, which is what usually we look at. But we also learned that there's a gender effect. The extent to which men and women take family considerations into account when they make their decisions differs. And this difference is not surprising. And maybe it's so obvious that studies take it for granted. But I think that focusing on it and investigating it might be an important step in understanding the how gender works in the intersection of family and career. And I think this study makes a contribution in this direction. Now, in fact, this study finds a double gender effect. I called it a grandmother effect and a daughter effect. I'll talk a little bit about the implications of the grandmother effect and of the daughter effect, and I'll end with some methodological issues to think about. But I know we're short on time, and I'll be brief with my comments. Okay, so let's start with the grandmother effect. And the picture is good here for this. Okay. On one hand, this is surprising, because studies, even using share data, do find that a lot of grandfathers provide grandchild care. But at the same time, it isn't surprising, because the same studies do find that more grandmothers provide care than grandfathers, and they provide more care in terms of hours than grandfathers. And in fact, grandfathers might become involved in grandchild care because their wives, the grandmothers, are so involved. So you have coupled data and share, and you could use this to test for these kinds of effects. Of course, this caregiving role is consistent with traditional gender roles in the family. Women assume the caregiving roles with their children, and they're likely to take it with their grandchildren as well. If this caregiving role creates work-family conflict, it's reasonable to look forward to retirement to reduce the stress. It would be interesting to see whether the grandmothers who look forward to retirement are currently also looking after their children. Share has information on time spent with caring for grandchildren, and you could control for this, and that would strengthen your argument, because if it has a direct effect on the desire to retire. This could also contribute to the literature that talks about grandparenting and stress. There's a debate about the effects of grandchild care on health. Some studies find that grandchild care causes stress, but there's also evidence that babysitting for grandchildren has benefits. Grandchild care is rewarding and affirming, and study shows that grandparents who care for their grandchildren enjoy the time they spend together. Okay. Well, here, this is in parentheses, but we know from studies, even using share, that countries that provide more child care, grandparents do less of it, and it makes you wonder if they're not paying a price in their well-being if they don't get the chance to babysit their children, at least for 3 hours a week. So welfare and well-being, you can think about that. There are lots of studies of loneliness in older age, and definitely this can be related to it. Okay. This also raises some new interesting issues. For example, the rise of childlessness. Fewer adults will ever experience the pleasures or the stress of grandparenthood. And I actually was surprised how many of your sample don't have any grandchildren. Furthermore, the delay in childbearing will delay the age of transition to grandparenthood. And with it, there'll be a delay in the onset of work-family conflict in grandchild care. Another issue is the rise in divorce. This will affect grandparenthood as well. We know from studies that after divorce, the paternal grandparents have less contact with their grandchildren than the maternal grandparents. And I'm guessing this is even more so if the mother remarries. You can control for the marital status of the parent to see whether the effect differs for sons and daughters. And this leads me to the daughter effect. Now, even though this daughter effect is consistent with other studies using share, somehow it seems, on the face of it, less obvious and more difficult to explain than the grandmother effect. We know that daughters tend to care for older parents more than sons from other studies. So we can ask whether this is part of a long-term reciprocal relationship between parents and daughters. And this also raises some questions, some of which can be answered with share data, some cannot. First, do daughters live closer to their parents than sons? We can know this from share, partly. And if so, it would be interesting, and this we cannot know from share, I think. It would be interesting to know the process. Do daughters choose to live close to their parents? Do parents move to live closer to their daughters? What's happening here? Are the relationships with daughters better or more frequent than relationships with sons? And this you can know from share. You do not have data in share. These questions bring us back to where we began, to thinking about how parents and children's lives are linked and how these links may differ for men and women and how they may change over the life course. Now for the methodological issues that I promised. First, share our panel data, and this study uses 2 waves, but it wasn't clear to me what we benefit from using 2 waves over 1 wave, because it didn't seem to me there are any time-varying covariates. I know age changes, but it didn't seem that there was any measure of change in the dependent variable either. So maybe people change their desire to retire between wave and 1-2, and maybe they have new grandchildren, and such changes can be theorized and they can be modeled, but most people probably have no change, and we're just measuring, or I'm asking, are we just measuring the same people twice? And if so, this creates problems of independence in the model. So I wasn't clear about that. The data also include many couples, partners who share the same grandchildren. So maybe we have a problem of independence that should be addressed, but it's also a resource because the couple data can be utilized to develop your questions further. So it could be interesting to see what happens there. I'm wondering what would happen. This is regarding the grandparent variable. I'm wondering what would happen if you created a variable any maternal grandchildren and combined the maternal with the both maternal and paternal. Because right now that variable is sort of strange. It works in the opposite direction of maternal, and it needs further investigation. I wasn't clear what's going on there. And also I was wondering if you want to change. There is a funny effect there that gender matters. Women have an effect. I was wondering maybe you could pull the data and run interactions by gender to strengthen your argument. One last point, and this doesn't have to do with grandparenthood, but I was surprised. I was surprised that job satisfaction was not at all a predictor to looking forward to retirement. I would have expected it to be. I'm not an expert. Maybe everybody knows this, but I was surprised. Maybe other things are much more important. For example, having a pension. And maybe it's not a measurement issue at all. But I'm wondering whether the original variable that you didn't use because it's very skewed and problematic, I'm wondering if it might be a better predictor than the constructed variable just because the people who really, really, really hate their job, maybe they're the ones who want to. I don't know. Anyway, I promised to keep my comments short to allow for questions and for the other people to present. So thank you again for your interesting and thought-provoking paper.
It's more thoughts than comments after reading the paper and also hearing the comments. It's maybe a bit of a follow-up. I wonder if there are differences between state and the matter that parents live next to their children, not only between mothers and maybe this is part of the explanation. And the second thought that is connected, and it also connects to the paper that Aliza presented yesterday. Maybe part of the satisfaction of having grandchildren or living next to grandchildren, if this is in fact the reason, is that also the grandparents know that their children will take care of them, and it's part of, so they feel more confident to retire because it's some kind of mutual expectations or something like that.
Oh yeah. Okay. So just thanks a lot. in fact, this was a missing issue in the literature, so I was kind of waiting for this paper to be written, and it nicely falls in line with what we would expect in general, and then this a bit surprising conditionality that is really just present for the maternal grandchildren. I think this would be interesting to try to tease it out a bit more to the extent that you're able to modeling-wise, and then maybe go a bit more into the evolutionary theory. That, I mean, you mentioned just briefly, but I think one could build even a stronger case then for this argument. And then just one methodological caveat. The issue of self-selection. You probably thought about it already, and you kind of mentioned it in the introduction. So you have a sample here of only employed persons, and yet what your dependent variable is if you're looking forward to retirement. So obviously, people that very much look forward to retirement are already retired to a large extent in this age group. So you have a bit of an issue here, and I'm aware that with the data at hand, being only 2 waves, there's only so much you can do. But I would at least try to convince the reader by maybe constricting the age range, just 50 to 59 maybe, to see if anything major changes, because otherwise one could really start questioning a bit the underlying assumption. For instance, in the descriptors we see that in Belgium the percentage of those that look forward to retire is pretty low, which is very surprising because it's one of the early exit countries per excellence that we have in Europe, and also in other evidence on retirement preferences, they turn out to be, they like early retirement. So I think this may be related, and I think you should try to address this issue to the extent possible.
I have 2 questions. One is concerning this higher percentage of men or of women that, if I don't look forward retirement, is so this is men, no? Is men that are higher. So are you controlling for the fact that they're caring for other person? So the fact that women, since they are providers, 2/3 of women are care providers, can be that they don't want to jump into their double or triple burden, and they prefer just to work and not to retire. So I just wonder if you have some control for, because in the shared data I know that there is the grandchildren question that is separated from the number of hours that you spend giving care on other particular. So this is the first question. And the other one is, as you correctly highlight in the conclusion, the idea of childcare institution. This is a powerful topic and issue in OECD countries, because you can see that really what's going on is that 30% of grandparents are caring for their children. We issue a document 2 weeks ago about intergenerational solidarity, where we look at this issue, and it can be that really one hypothesis, working hypothesis, is really the fact that childcare institutions are present or not, and grandparents are taking on this role. So I was wondering if you don't have, since you have more countries and the waves are close, but this can give you a kind of variability in the observation using this element.
Okay, I have a question about the health parameter. I would expect that women who are healthy would like to retire so they can take care of the children. And if I understood correctly, your health parameter works the other way.
Health is right. It's the
Poor
last
health?
one.
So the poor health,
It's insignificant.
it drives.
basically.
It is insignificant.
Yeah, everything that crosses the blue line of the 0 in this graph is insignificant. So I don't get a significant, and it could be explained easily by the number of cases, I believe, because the variance is not very large, and we don't have a lot of respondents who.
But we know that poor health is a major variable in the willingness to participate, and so. Okay.
I have the same question about competing potential demands for care. as options for work. And spouse's health measured in share?
Yes, we do have a question whether the partner is in need of care. And this is controlled for, but
You
was
controlled
not
for it.
significant.
Okay,
Yeah.
all right. Because in the United States, we find the trend towards women wanting to stay longer, and two predictors are, one, they're vesting in their own pensions, and they've worked less, and so they work longer. And two, they just don't want to go home and make lunch for their husbands.
Yeah.
You mentioned a few times during these past few days that women did not want to increase their retirement age here in Israel. That the option, and opted not to.
They don't want to go to earlier retirement in here.
Either.
Can I just...
Yes, you certainly may.
No, אתה רוצה לענות לחלק מהשאלה?
I want to ask you, I think, well, I may have missed something. I'm not sure, well, I'm talking now about the country differences. And one possibility indeed is this policy, different policies between countries, but you should also consider the culture in general and feminism as a topic. And actually these countries are feministic countries, so I know that it's not an explanation. Well, you cannot tease out the mechanisms, but culture has a lot to do with it. And I'm not sure the gender role has anything to do here. Okay. I'm not convinced that there is any kind of gender role here because women don't want to retire. And I actually was thinking on the same explanation that women want to push retirement because they don't want to jump into this work. So if men are willing to take if men are willing to take early retirement because they have grandchildren in general, then it's against the gender role type of thing. So I wouldn't stress this one too much.
Maybe just a couple of notes about the variables. Alisa, you're right, I'm not doing fixed effects at this point. One of the reasons is simply that the within variance is very low and you hardly get any significant effect. The number of grandchildren does not change very much and there's nothing to gain. But you're right that I'm not using to the most the panel structure of the data. This is why I'm pooling. The only thing that we do gain by pooling the data together is a little bit more cases. Because of the certain limitations that we have about participating in both waves, etc., we can gain a bit more cases in this manner, which is why I chose this strategy. But apart from that, you cannot gain much. With regard to potential biases, what we did is to control with the Hubert sandwich mechanism, and we clustered our respondents according to ID, so that the problem of repeated measures is gone. I also tried to cluster it according to households, because we have sometimes two people in the same household. The results remain robust anyway, so I don't think this matters so much, but they are clustered. With regard to care and need and so on, I did control, I forgot to mention it in the slide, but I did control for whether partner is in need of care, whether partner is already retired, and also whether partner is out of work. I think the few cases might be the reason for the fact that I do not find significant effects. I didn't look at how many hours or something like that, not yet. This is, as I said, preliminary analysis, and from what we use so far, it wasn't significant. I also did not look into how many hours you take care of the grandchildren and so on, because the main idea was, first of all, to see whether it even matters, that you only have grandchildren, regardless of how much time you spend with it or not. One of the ideas behind it was more of a psychological idea about changing roles and maybe giving up the role of an employee or someone who's active in the labor market in return to taking on the role of a grandparent, which comes kind of onto you regardless of what you want, because your children are actually doing the act. So this was the main idea, but I agree that it's worthwhile to look into it, no question about it. About the rest of it, yes, we do need to find more refined measures maybe for childcare facilities. I did try to control for it, even just as a additional macro variable in the same analysis, not doing multi-level models because we hardly have enough cases on the second level. But nothing came significant so far. I think it might be because the data that I found in the OECD statistics about how much what is the percentage what is the share of GDP that is invested in childcare, the differences were not big enough, so I'm probably not using the right variable. It would be nice if you could maybe afterwards give us a hint about the right way to go. Exactly. So this would be definitely more useful.